Tuberculosis, an ancient disease, still casts a long shadow over global health. We often discuss TB in terms of statistics, but behind every number is a human story. These stories are deeply intertwined with gender, a social construct that shapes our lives from birth. Gender influences not just our biology, but also our opportunities, roles, and access to resources. When it comes to TB, gender acts as a lens, magnifying vulnerabilities and shaping healthcare experiences. In some communities, men may face greater occupational hazards, while in others, women might bear the brunt of caregiving responsibilities, hindering their ability to seek timely treatment. To truly address TB, we need to look beyond the disease itself and acknowledge the social fabric in which it thrives. This means understanding local contexts, the cultural norms, economic realities, and power dynamics that influence how different genders experience TB. A one-size-fits-all approach simply won't cut it. By acknowledging these nuances, we can develop interventions that are not only effective, but also equitable and just. The statistics paint a stark picture. Globally, TB affects men more than women. The World Health Organization estimates that in 2021, for every 100,000 people, approximately 134 men fell ill with TB compared to 83 women. But these numbers only tell part of the story. While men may have higher incidence rates, women often face a different set of challenges. In many low-income countries, women are more likely to die from TB due to barriers in accessing healthcare, poverty, and malnutrition. Furthermore, the epidemiology of TB is not static. It is influenced by a complex interplay of factors including age, socioeconomic status, and geographical location. For instance, in certain regions, young women bear a disproportionate burden of TB due to factors like early marriage and limited access to education. Understanding these epidemiological trends at the local level is crucial for developing targeted interventions and ensuring that everyone has an equal chance to live a TB-free life. While TB is a bacterial infection, its impact extends far beyond biology. Social determinants of health, the conditions in which we are born, grow, live, work, and age, play a significant role in shaping vulnerability to TB. Poverty, for instance, creates a vicious cycle. It limits access to nutritious food, safe housing, and health care, making individuals more susceptible to TB infection and hindering their ability to seek timely treatment. Gender roles and expectations further exacerbate these vulnerabilities. In many societies, women and girls face barriers in accessing education and employment opportunities, limiting their economic independence and increasing their risk of poverty. They may also face restrictions on their movement and decision-making power, hindering their ability to seek health care. Cultural norms can also influence health-seeking behaviors. In some communities, TB may be stigmatized, leading to delays in diagnosis and treatment, particularly among women who may fear social isolation or discrimination. Addressing these social determinants is not just a matter of public health, it's a matter of social justice. By tackling the root causes of inequality, we can create a world where everyone has a fair chance to live a healthy life, free from TB. Access to quality healthcare is paramount in the fight against TB, yet for many, it remains a distant dream. Gender intersects with various social and economic factors to create significant barriers to healthcare access, leading to disparities in TB diagnosis, treatment, and outcomes. Women, particularly in low-resource settings, often face a multitude of obstacles. They might need permission from a male family member to seek healthcare, or they may prioritize the health needs of their families over their own. Distance and cost also pose significant challenges. Women might have to travel long distances, often with children in tow, to reach healthcare facilities, incurring transportation costs that can be prohibitive. Furthermore, healthcare systems themselves may perpetuate gender biases. Women may encounter healthcare providers who lack gender sensitivity, or who hold biases that prevent them from providing equitable care. Addressing these healthcare access barriers requires a multi-pronged approach. This includes investing in accessible and affordable healthcare services, empowering women through health education, and training healthcare providers to ensure gender-sensitive care for all.